So when you hear the word cocaine, you probably picture crime, addiction, a massive global black market, right? But what if I told you that for a brief, shining moment in history, it was celebrated by doctors, popes, and presidents as one of the greatest medical breakthroughs ever? Let's get into the absolutely astonishing story of how cocaine went from a celebrated wonder drug to a controlled substance. And if you want to know just how celebrated it was, look no further than Sigmund Freud. Yep, that's Sigmund Freud. In 1884, he called it a magical substance. He was praising it as a cure for just about everything from depression to morphine addiction. And look, this wasn't some fringe opinion. This was the enthusiastic view of one of the most influential thinkers of the time. So how on earth did we get from that to where we are today?
Well, the story doesn't start in a 19th century lab. Not even close. It starts thousands of years earlier, with a simple leaf growing high up in the Andes Mountains. Long before it was ever a refined white powder, the coca leaf was a cornerstone of ancient South American cultures.
What's really wild here is just the sheer scale of this history. We're talking millennia. For thousands of years, indigenous peoples chewed coca leaves to fight off altitude sickness and to get a boost of energy. Then when Spanish colonizers showed up, they tried to ban it at first, but they very quickly realized its power. So instead, they started taxing it and using it to fuel forced labor in their silver mines. But the real pivotal moment, the one that changed everything, came in 1860 when a German graduate student named Albert Niemann figured out how to isolate the leaf's active ingredient.
And what he created was cocaine hydrochloride. Now, the main thing to get here is that this wasn't just raw coca. This was a stable, predictable, crystalline salt. And the most important part? It was water-soluble. That was the key. It meant the substance could be easily dissolved, measured precisely, and put into drops, tonics, and injections. It basically turned it into the perfect candidate for medical use.
And with that, the stage was set. Cocaine exploded onto the medical scene. The 1880s became its golden age, a time when it wasn't seen as a threat at all, but as a revolutionary cure that was going to change medicine forever.
The big breakthrough came from a 27-year-old ophthalmologist named Carl Koller. He was inspired by Freud's work, so he tried putting cocaine hydrochloride drops into the eyes of some lab animals and then into his own. The effect was just profound. Complete numbness. For the first time in history, doctors could perform delicate eye surgery on a patient who was wide awake, felt zero pain, and wasn't at risk from really dangerous general anesthetics like ether. It was an absolute game changer.
And this right here shows you the immediate impact. Just look at these production numbers from the pharmaceutical company Merck. In 1883, they produced less than half a kilogram. 2 years later, right after Koller's discovery, that number skyrocketed to over 83,000 kilograms. The demand was instantaneous, and it was enormous.
From there, it just built into this full-blown cultural phenomenon. I mean, in 1886, Coca-Cola launched, and yeah, it originally had about 9 milligrams of cocaine in every glass. A year after that, the U.S. Surgeon General was officially endorsing it, and by 1890, even the fictional detective Sherlock Holmes was making its use seem glamorous. It was literally everywhere.
And I mean everywhere. You could just walk into a store and buy over-the-counter cocaine toothache drops for your kids, use a cocaine spray for your hay fever, or take a cocaine tonic to improve your singing voice. It was marketed as the ultimate cure for nerve exhaustion, and it even got endorsements from huge figures like Thomas Edison and Pope Leo XIII.
But you know, as this miracle cure spread like wildfire, its dark side started to creep out. That initial wave of euphoria and praise began to give way to reports of addiction, paranoia, and some pretty devastating consequences that nobody had seen coming.
The irony is just staggering. At the very height of its popularity, the official position from the U.S. Surgeon General was that the risks of cocaine addiction were minimal, certainly less dangerous than alcohol or opium. This official confidence was completely masking a crisis that was growing bigger by the day.
Because just a little over a decade after that dismissive statement, this was the reality on the ground. An estimated 200,000 Americans were addicted to cocaine. The wonder drug had created a massive public health problem, and it had moved far, far beyond its intended medical uses.
And as addiction grew, the story in the media turned sharply. Newspapers started publishing these sensationalized stories linking cocaine use to violence and crime. It's really important to note here, as the historical sources show, that these reports were often racially charged, making claims that the drug made black men uncontrollably violent, which just helped fuel a moral panic.
So, with public opinion soured and the addiction crisis impossible to deny, the era of cocaine as a celebrated cure was over. The next phase of its history would be all about regulation, prohibition, and its transformation into a criminalized substance.
The legal clampdown basically happened in stages. It started in 1906 with the Pure Food and Drug Act. Now, this didn't ban cocaine, but it did require it to be listed on product labels. That bit of transparency was enough to make companies like Coca-Cola quietly remove it. But the real turning point was the 1914 Harrison Act, which effectively banned non-medical sales and drove users underground. And then, finally, the 1970 Controlled Substances Act sealed its fate, officially classifying it as a dangerous drug with a high potential for abuse.
So where does that leave cocaine hydrochloride today? Well, its story didn't just end with prohibition. Instead, it kind of fractured, and now it exists with this really complicated and contradictory dual identity in our modern world.
On the one hand, believe it or not, it's still a legitimate medical tool. The FDA has approved modern drugs that use cocaine hydrochloride as a topical anesthetic for certain nose and sinus surgeries. But on the other hand, it's the fuel for a massive, illicit global trade, with an estimated 25 million users around the world.
And that illicit market isn't shrinking. In fact, according to the UN, the number of global cocaine users has grown by a staggering 47% since 2013. The problem that started brewing in the 19th century is still growing and evolving today.
Ultimately, cocaine's journey from medicine to menace was this complex storm of genuine scientific discovery, unchecked commercial hype, and eventually social and racial fear. It's a really powerful reminder to ask a critical question. What does this history teach us about how we evaluate, celebrate, and maybe regulate the miracle cures that are being promised to us right now?